So you want to get pregnant right now? Let me tell you everything you need to know. Welcome to the Hypno-Baby channel. I'm Dr. Nathalie Fiset. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. I know you're busy, but I'm going to try to cover everything you need to know if you want to get pregnant. First things first, if it's obvious, but if you're on the pill, you have to stop the pill or any kind of birth control method. If you have to know, you don't need to do that 3 months of waiting, like if you stop the pill to wash it out of your system, that medical studies prove that it's not necessary. On the other hand, you have to know that if you were on the injection like Depo-Provera, it might take a while before your fertility comes back because it's a slow release medication. So it might not happen like right now, and that's perfectly fine. The one thing you can do is go to the pharmacy or take an appointment with your gynecologist and then start taking your folic acid. And there's enough folic acid in prenatal vitamins, so you want to start your prenatal vitamins because it's recommended to start before conception. And we rarely see you at the office before conception, so that's why I'm telling you, if you're planning on conceiving a baby, best time to start folic acid is right now. You have to know also, if you're older, I'm sorry to say, you have less valuable eggs, and it might take longer to get pregnant because let's say you're over 40, there's cycles where you won't have an ovulation, so you have less chance, and there's only 12 months per year, and if out of these months there's months that you don't have, you don't ovulate, that is less. So what I recommend is you get a big calendar. I'm like still on paper, but you can get an app and mark down your period. What we know is kind of backwards. We know that your period starts 14 days after your ovulation if the egg has not been fertilized, which is the case. Okay. So when you write your period, you go 14 days before that, and that was your ovulation. So if you have long cycle like 31 days, you don't ovulate on day 14, you ovulate on day 31 minus 14, day 17. Okay. They say that the sperm will can survive 5 days, and the your eggs can survive 24 to 48 hours. So there's a window. Okay, you don't just have intercourse on your ovulation that you calculate. You try to go like, let's say you have a cycle of 28 days, so ovulation's day 14. So they recommend between day 12 and day 16. Of course, you could have shorter cycles or whatever, so having intercourse before that or as soon as your period stops is fine. You're like putting money in the bank, if I can say so. They recommend not to overdo it. Some women want, like, okay, let's conceive, because then the sperm is not as concentrated and it's not as good. So they say every second or third day is sufficient. So try to aim in that period and be patient. It might not work the first time around, and that's perfectly fine. There's ovulation kits, but then again, you're stressing yourself, like looking okay, and then calling, oh, come quick, and like you see in movie, come quick, I'm ovulating. It's not that short of a window. You can wait until tonight and be romantic. There's been some studies, and because at one point they were saying, well, if you have an orgasm, like you squeeze the sperm in and it would like go further, but uh, there's no scientific data that supports that. But the other thing that the medical community was saying is that if you have an orgasm, you're more relaxed, so then it helps to conceive. So that could be like, okay, win-win. Definitely. The small recommendation for men, and I'm sure you've seen that in movies or television series, is heat is not good for the sperm count and their testicles. So they should avoid. There's always that joke about wearing boxers instead of briefs and blah blah blah. But also like avoid spas because they're too hot, and that could lower the sperm count. That is true. Same thing for men. If they smoke, they're little swimmers or lazier, and you have less chance of conceiving. So you both have a good reason to stop smoking if you're smokers. Your chances of conceiving a baby changes with age. The older you are, the not the less, but it takes longer to happen. And at one point, you might have cycles where you don't ovulate as you pass, let's say, 40 and 45, even more. We don't talk about infertility until 1 year of trying to conceive because we know before 35 years of age, you have to fun, for 1 year before we talk about infertility. If you're over 35, they cut off the point to 6 months of trying. If you're over 40, they say consult your gynecologist as soon as you can because there's so many things that are different. So we're gonna clean everything here in your body and in your mind. So cleaning the mind is pretty easy. Stress is really not good for conceiving, so you have to lower your stress. It's a proven fact that people that are in infertility clinics and infertility treatment cost so much and are not always covered by insurance, so they get stressed, and it's a vicious cycle because if you're stressed a lot you don't ovulate, so it's harder to conceive, and then you're stressed more and so forth. So try to trust the process and relax. If you need support, if you need to see a therapist, if you feel like it's all that's the only thing that's in your mind is conceiving, well, first, like I always used to tell my patient that wanted to conceive, just do renovation or go on a long plan a long trip, and sure enough, you'll get pregnant because your mind will be somewhere else. I was giving a television interview, and the woman that interviewed me said, I'm sorry, I cannot conceive. It's been 10 years in fertility clinic, and I've been diagnosed with unexplained infertility. And I said, the best way to conceive a baby is to adopt a baby that will get your stress down, and sure enough, you'll ovulate. And 1 year later, I saw in the newspaper that she was pregnant and she had adopted a baby a year before. So that was really funny. Like, I felt almost like a witch, a little. But it shows you, like, you don't know. And the other thing is, so many people think they're infertile. They came to my office and they said, well, a doctor told me I'm infertile, and they were pregnant. And I'm like, you know, you never know unless they took out your uterus and put it in the bowl. Don't consider yourself infertile, and if you don't want to get pregnant, use birth control method. So getting back to wanting to get pregnant, trying to get pregnant, don't try too much. The more you try, don't take the romance out of it. Just go with the flow. So cleaning the mind, we just said stress, you have to eliminate that. And now cleaning the body. No more smoking, sorry. We have in the Hypno-Baby, we have a kit that addresses stop smoking specifically. So that's one thing. If your spouse is also smoking, should stop too, because passive smoking is also not good. And for the baby, you're gonna have like a little set of pink lungs in the house, so you don't want any smokes in the house, or smoke smells. So stop smoking while you can, or at least lower as much as possible. No more drugs, sorry, no more fun. Same thing for marijuana. We don't know much the effects on the baby, so that's not recommended, definitely, of course. Alcohol, start tapering down, because ideally one, and not ideally, it's highly recommended that when you're pregnant you don't drink at all. If you're going to a party and everybody's cheering, let's say it's New Year's, you could always have like either apple juice or just there's alcohol-free champagne, and you just cheer people and they won't bug you. Because I know some people like would pressure you, like, oh, have one, it's okay, I drank during my pregnancy. And you don't want to fight people, you don't want to stress, like we were saying. The other thing is exercising is good. It pumps the blood, and it pumps the blood everywhere, so to your organs as well. So moderate exercise. If you over exercise, let's say you're a long distance runner, and you train like many hours per day, actually a lot of women athletes, their period stops completely, because their hormones is like, their body is all focused on the training, so there's not enough blood flow, and their hormones are all out of balance. So not over exercising, but regular exercising is very good to pumping up your blood to your reproductive organs, and it increases your chance of conceiving a baby. As I was saying, be patient. Within 1 year, 85% of women will get pregnant, but it doesn't happen the first month. There's also like during those 12 months, there's also like sometimes women will say, oh, I'm late, like you see in movie, oh, my period's late. And then they say, oh, my period came. Well, these are often early miscarriages. So there's way more pregnancies than we see, because they never did a pregnancy test. So, and it's okay. Most of the times when you have an early miscarriage, it's because the baby was not perfect. So Mother Nature corrects her mistake. And it's sad. And if you did a pregnancy test and you were all happy and celebrating, and then you do a miscarriage like a couple of days later, the only consolation is that the baby would not have been like valuable, and would have like a lot of problems, health problems, or would not have survived if the pregnancy went on. So Mother Nature corrects her mistakes. It's hard to take. I know I've had a miscarriage too, so I know, but it's part of life, okay? And it's better to have a early miscarriage than a child that's severely handicapped and suffers. So getting back to eating well, and also avoiding the food that we discussed in the other videos about you don't want to catch listeriosis or toxoplasmosis. So no raw meat, no raw fish, no soft cheese. So that's all covered in another video. They also say have, be at your ideal weight, body mass index 20 to 25. It's not that easy, and it's okay if you have a few extra pounds, and don't go drastic, like, starving yourself to get into that window. It's better to have a couple of pounds too much than, being starve yourself. But aim as much as possible to have a healthy, I prefer healthy than, ideal. So healthy body weight, and it will also lower your risk of having like diabetes, what they call the metabolic syndrome, and which is also like part of pregnancy, the combo. So high blood pressure, diabetes, and preeclampsia, and all the complications. So you don't want that. If you have any kind of thyroid problems, make sure that your thyroid is in check. So, and it's okay to keep taking your Synthroid, your synthetic thyroid hormones, because you need them. These are your batteries, and you need them to conceive, and you need them to live. So definitely take an appointment with your doctor or your midwife and have that checked. Also, ask your mother or your grandmother, or if you have aunts around, if there's any kind of rare disease in the family, things that you should know about. Same thing for your spouse, if there's diseases, because sometimes there's inherited diseases, and then you can have it checked. They also recommend, but that's like less, like, yes, stop smoking, but less caffeine. So 2 coffee per day, or the equivalent in tea and soft drinks. It all adds up, and there's caffeine in chocolate also. So yeah, life is tough. So lower your caffeine consumption. You might be one of the lucky ones that feel their ovulation. It's usually like in the lower abdomen, either on the right or the left side. And it's like a little pinching. It's a numb little pinching. It lasts like 1 day usually. If you're lucky, then you actually know, okay, I conceive on the left side or I conceived on the right side. It can happen. Not everybody feels their ovulation, but if you pay attention, and sometimes you might like not think about it, and then you go, oh yeah, I'm feeling something on, and then you look at the calendar, you're going, it makes perfectly sense, and let's have fun tonight. The other thing is your cervical mucus, okay? Because if you're not on the pill or anything, you're producing more mucus, and it gets like a little thicker. It's like egg white kind of thing. I'm showing you with my fingers because that's gonna be what I'm telling you about. It's kind of gruesome, but you could always dig in your vagina in the morning. But sometimes you feel it even in your panties, like in the morning you would have like a little drip. But you can dig in, and if it's like it breaks, that means it's not ready. Because usually the cervical mucus is like an elevator up to your uterus, like to for a baby elevator for the sperm to get there. So when you can like pull it between your finger, like kind of a glue or an egg white, okay, that means you're ovulating too. If you have that with the little pinching on either side, you're in business. That is the best time. Um, they did some studies again, and putting your legs up, putting a pillow under your legs, and everything. They say it doesn't change anything, but honestly, if you have intercourse and then you run to the bathroom because you don't want to do a bladder infection or a yeast infection or whatever, then most of it will fall in the toilet bowl. So waiting a couple of minutes, it pleases my mind at least to think that staying in bed right after intercourse for a couple of minutes would be sufficient. After that, the swimmers are gone, and they're by millions, so that's fine. But if you rush out of bed right after like intercourse, um, you could be losing some sperm. The last thing I want to talk about, and it kind of again goes against what I'm proning, but it's true. It's not a medical study per se. It was a demographic data analysis, but one person, a man, studied 10,000 women, and if you have an older child and you're still breastfeeding, and if you're solely breastfeeding, like meaning all the time, that's all baby is taking, it can cause contraction and oxytocin and all that stuff. And it could be harder to conceive another baby. I've had a patient, and that's more like an anecdote that I'm telling you. She was breastfeeding the older one, and sure enough, she had 3 miscarriages like back to back. And then she said, I think it's whenever I'm breastfeeding, I feel my uterus contracting, so I think it's not helping. So she stopped breastfeeding, and sure enough, she got pregnant the month after. But like I said, it's more an anecdote. That's not scientific in any way. It just happened, and I want to relay that. But that demographic, it was not a medical study controlled and everything, but that demographic study, he looked into 10,000 women, and the one that were solely breastfeeding had a higher trouble conceiving, getting pregnant. So if you feed the baby with formula or food, then it did not change anything. Then they were able to conceive. On the other hand, though, the World Health Organization has been saying and repeating that if you breastfeed solely, like you don't give baby formula or food, it's a good birth. You cannot get pregnant. It's a good birth control method, which made me cringe every time because I could fill a stadium with my pregnant patient, my patients that got pregnant while breastfeeding solely. So I know for a fact that's not true. So, and World Health Organization, you would think they know, but apparently not. They also recommend that you don't use any lubricant because some lubricants will lower the sperm count or make them swim slower. There's some lubricants that on it is going to be written fertility compatible or good for fertility or whatever. But you have to know that since you're not taking birth control method, the pill, or any other hormones, actually, like we were saying, you get cervical mucus. So you're actually lubricated down there. So most probably you don't need any lubricant. If you have the opportunity to take an appointment with either your midwife or your gynecologist or your family doctor, do so. They might see things, they might give you other advice that I don't see. Also, consider what kind of work you're doing. If there's risk of having hit on the belly or whatever, there's preventive leave sometimes that you can ask for, or if you work with toxic products. It depends on the country you're in and the laws, but that's something you have to consider. And you could see around, like if there were women before you that got pregnant, if they got like reaffected to another job, or what happened, or if they were sent home because it was too dangerous for their pregnancy or for themselves. So that's it. You're ready. Just go and have a baby and then come back once you're pregnant. But again, don't stress out about it. Just have fun. Do a PS. I've seen it so many times in my practice that people wanted to get pregnant. They were trying to get pregnant, and then life happened, and they were on the edge of splitting up or getting a divorce. And finally, she got pregnant, and that was a catastrophe every time. They were torn between pursuing the pregnancy, having shared custody of an unborn baby, or what have you here. So if you are in that situation where things are not optimal and it's not an option anymore that you want a baby, restart your birth control method, okay? Because I've seen it so often, and it was like the bittersweet and the worst situation because the parents were torn in that situation. As much as they wanted the pregnancy, it was not a good timing, and they were stuck in front of this very hard decision to take, and it complicated things so much. So if always evaluate, or do we still want to get pregnant? If the answer is no, then grab a birth control method. And by the way, I've had a patient that was 49 years old, and she let her guard down, saying, the odds are so low that she did not. And again, she was in the situation where they had tried and they stopped trying, but they were not taking any birth control methods. So eventually her period stopped, so she thought it was her menopause, but eventually her menopause started moving. She was pregnant at 49. She had a beautiful baby. She had a beautiful birth with the Hypno-Baby program. But it just shows you that Mother Nature is strong, and those babies have a will of their own. So if your situation changes and you don't want to get pregnant, take your precautions so you don't have to face that very hard decision. I feel like I need to do a PS. I've seen it so many times in my practice that people wanted to get pregnant, they were trying to get pregnant, and then life happened and they were on the edge of splitting up or getting a divorce. And finally, she got pregnant, and that was a catastrophe every time. They were torn between pursuing the pregnancy, having shared custody of an unborn baby, or what have you here. So if you are in that situation where things are not optimal and it's not an option anymore that you want a baby, restart your birth control method, okay? Because I've seen it so often, and it was like the bittersweet and the worst situation because the parents were torn in that situation. As much as they wanted the pregnancy, it was not a good timing, and they were stuck in front of this very hard decision to take, and it complicated things so much. So if always evaluate, or do we still want to get pregnant? If the answer is no, then grab a birth control method. And by the way, I've had a patient that was 49 years old, and she let her guard down, saying, the odds are so low that she did not. And again, she was in the situation where they had tried and they stopped trying, and but they were not taking any birth control methods. So eventually her period stopped, so she thought it was her menopause, but eventually her menopause started moving. She was pregnant at 49. She had a beautiful baby. She had a beautiful birth with the Hypno-Baby program. But it just shows you that Mother Nature is strong, and those babies have a will of their own. So if your situation changes and you don't want to get pregnant, take your precautions so you don't have to face that very hard decision.